So health and healthcare are among the most important factors in human lives, yet half the planet lacks access to adequate medical care. My guests today are working to change that. They're using AI to build innovative platforms and tools to make healthcare more efficient and accessible to the people most in need. Dr. Joan L is Assistant Professor of Pediatrics at Harvard Medical School and an Associate Chief Medical Officer for Transformation at Boston Children's Hospital. She's also co-founder and president of Virtue Foundation, a global nonprofit that sends physicians on medical missions around the world. Rob Reed is with the tech company Databricks, where he's global director of university and nonprofits programs. He works with universities to integrate AI and data science into curricula. Arson Tavakoli is co-founder of Databricks and senior vice president, field engineering. Welcome. So first, Joan, tell us about the Virtue Foundation's mission and why it decided to get into AI.
Sure, babe. Thank you, Sharon. Virtue Foundation's an NGO with special consultative status to the United Nations. We work in the area of global health. We have teams of physicians and surgeons on medical missions in over 30 countries over 20 years. And my colleague, Dr. Abi Elahi, is an oculoplastic surgeon at Mount Sinai. In 2010, came up with this vision of using AI to help us understand the situation on the ground and to be able to better match our medical and surgical teams with the areas and people that needed their care most.
As a follow-up question then, so do we know BF Match, Virtue Foundation's signature project, aims to create an efficient marketplace for medical philanthropy? I know a little bit about official markets from being a former financial regulator, but how does that work in VF Match?
Thank you, Sharon. It's a really great question. I think the vision was, and as I said, Dr. Elahi really saw this as global health philanthropy as a lemon market. It's an inefficient market. The people who most need the care are the hardest in terms of trying to be able to make their needs known. They may be out of the digital world. They don't have good access to care, so they can't really be very vocal. And people like ourselves who are physicians on the sidelines who want to get engaged, there's a lot of frictions to getting engaged. Where do I go? Will there be patients to take care of? Is it safe there? So we decided that we needed to try to make visibility within that inefficient market, and that just moving information would impact millions of lives. And as an aside, there's 143 million people every year not receiving surgery in low and middle income countries that need it. So by being able to map that, we would be able to better match on top of it. And I don't want to take too much time, but just to say, the data wasn't readily available. Where are the healthcare facilities? Where are the healthcare NGOs in these low and middle income countries? And that's where the AI journey really began. And I know we're going to get into that a little bit more.
Yes. Thank you. So, Arson, Databricks is a pioneer in bringing together data and AI. Why is a project like VF Match so suited to Databricks, and what can AI do for healthcare access that hasn't already been done?
Thank you. So, great question. I mean, first and foremost, I give Joan a hard time. I think sitting next to her, I feel like there's a little bit of imposter syndrome and being very, underachieving relative to kind of what they've done. Look, I think, one of the things Joan and I were talking about before is like when we started, Databricks, one of the big things for us was how do we, help all organizations, but that included like, how do we do things that make a difference in the world, right? And we would always in the early days talk about like, can we someday be a part of, solving some chronic diseases? Can we also help with healthcare? Can we help with poverty and the like. And it's, but you're looking for the vehicles to do so, right? And so, I think VF's found, mission is pretty incredible in what they want to do. And it's a real world problem with real world challenges. And one of the things that was surprising to me, but perhaps shouldn't have been, is that there's a lot of factors that go onto it. But underlying many of it, one of the challenges is a data and AI problem, right? Where you're trying, like, how do you match philanthropy to actually the people in need? There's a whole, and why is it inefficient is because people don't understand who are the, like, how do you get data? How do you build knowledge graphs? How do you redirect resources to it? How do you have a view of that is frankly, not stale and irrelevant that people can use? And while this is an incredibly one of the most compelling use cases for it, that underlying challenge, which is how do we help organizations leverage data and AI to kind of impact what they want to do, was at the foundation of what Databricks was built for, right? And so I think for us, it was this notion of finding an incredible mission where data and AI could be useful, finding a partner who is basically like driven and competent to be able to get there. And all it needed from us was the technology and leaning in with resources. We're more than happy to do that a million times over. And I think that there's still the only, challenges. I still think that there's so much more to do, which is what Joan and I were talking about. Is like, how do we continue to help? How do we get to the next thing and never be satisfied?
Well, it sounds like a great partnership for sure. So, Rob, from your point of view, why is the VF match groundbreaking, and what can it do that couldn't be done before?
In looking at the project, I think one of the first meetings that we had with Joan, she talked about COVID and the 20,000 hours of clinical time that working doctors had spent building the original data set. And that's a lot of time. With this project, we've taken that 20,000 and we've cut out 99% of that human work and then made the data and AI work to address that need at the beginning. So what we've done is I look at it as we freed up tens of thousands of hours for clinicians to actually do their clinical work as opposed to doing work that the data and AI can do now.
That's phenomenal. Well, it's phenomenal. So then, Austin, what is the logical, next step for a project like VF Match? What is the great unrealized potential for AI? And what major challenges do you think AI will solve in the next 5 to 10 years? Those are two loaded questions.
First of all, that was more than two questions. There was like 5 in there, and they weren't exactly like light binary answer questions to be clear. And I have to be very careful of what I could say, because whatever I say here, Joan's like, you said it on record. Let's now talk about it. How do we make it happen? Look, I think that there is a ton of use cases there. Unfortunately, like some of the challenges that we're talking about, VF's mission now of like connecting philanthropy to it, there's no shortage of those kind of in the world that are left to tackle. I think one of my perspective is one of the main directions that we can go is we talk about data and AI, but still a lot of the uses are still heavier on the data side. Can we find the data? Can we surface it? Can we make it available? I think once the data is in a good place, because that's the foundation, and I think that's what Joan and I were talking about before, then you can really start harnessing the power of AI, right? Where you start thinking about, can we get to better predictive nature? Can you get to better forecasting? One of the challenges we talk about is not having data. Actually, with AI, if you have a good subset of data, you could start generating other types of data that gives insights as well. So I do think we are spending a lot of our time still breaking down silos, figuring out how do you get high quality data. And we're much closer. We're not perfect there, but we're much closer there. Once that foundation is there, starting to really leverage AI, there's like a whole world of it. And 5 to 10 years, frankly, for me is really far out. I actually think you just look at 1 or 2 years from now, some of the things that you'll be able to achieve, because the fact of having this type of data was considered almost impossible. Well, they had a vision, 15 years ago. The rest of us, thought it was much harder. But having that data, what you can start building on it, I think you'll see some incredible things. And the beauty of this is that when done well, it's not just some cool AI project. It has real world outcomes that really matter and, just basically are better for humanity in general. So very excited to see where some of that greater AI leverage will drive us in the next coming years.
Well, I think I'm going to start with Rob to get your last thoughts on kind of where you see things standing in the future.
A little bit of the past here. One of the reasons this project has been successful is when we first met with the Virtue Foundation, they had the vision, they had the people, they knew where they were going. And the success of projects like we talked about earlier today, so much depends on the people. We can put the technology in place, but if the people don't take the technology and make something useful out of it, then what's the point of it? So going forward, what excites me is we've got examples like this that we're putting out in the world, and they will just allow other examples to come forth. So it's the applied uses in domains that Arsalan and I can't come up with, but the people out there in the field who see this use case can take it and then do an adjacency or something totally new. And that's what's exciting is we're at an inflection point, and this is just going to multiply and have so much greater impact.
It's great to hear that 5 to 10 years is a way out. We're talking maybe 1 to 2 years. So, John, I want to get your last thoughts on that as well.
Sure. Thanks, Sharon. I wanted to touch on something Arsalan said about the predictive analytics. That is really key for us and at this future state. We've already built some of the predictive analytics where we can identify the actual medical deserts by specialty. So where are the deserts for ophthalmology or neurosurgery? That means large populations of people who need access to that care. I think what Databricks is really enabling is the best quality data for those analytics, where we actually have continual refresh data, where we know with much more accuracy and can do more of that forecasting that you discussed around that. So I think that's key, and Databricks is phenomenal in terms of creating an enterprise-grade solution. So to Rob's point, this is not something that's built for academia. This is built for real-world use, the same way it would be built for Bank of America or MasterCard or Procter & Gamble. They're building it for us as an NGO, and this is millions of lives. So really grateful for that.
And let's talk about some of the real use cases and some of the details. And so, hand the mic to you guys, Sid.
I think what's really interesting is that now that we have this data and we can start to identify the medical deserts, we've created this platform called VF Match, where doctors, physicians, healthcare professionals can use it to match directly with the locations, the healthcare facilities, the healthcare NGOs, to work on the ground in the places that need their specialized care most. The platform is live. We actually have people who are using it and matching it. We haven't done a public launch yet. Our plan is to do that in 2025 when we when we finish some of the work we're doing with Databricks. But we have 30,000 visitors a month to the platform. Perplexity AI quotes us as a source in global health, philanthropy. And we have several hundred people matching. So that is clinicians being matched with locations to work on the ground. So it's interesting to see the demand that there are people who really want to get engaged, and there's no other platform out there to let them know where to go. The other piece that I think is really interesting from a use case standpoint is governments are very interested in this data. Our teams traveled to Mongolia. The Mongolian Health Ministry and parliamentarians want to meet with us and work with us to see how these insights can be used real time within their own countries. Similarly, in Ghana, we have a similar experience. So we see that there's a need for health ministries as well. And I think that that's where the insights that Arsalan was talking about become so important. We've created optimization models where you can say, if you need to build another healthcare facility, where should it be based on the data, not based on politics or whoever can shout the loudest. The data can actually help inform you, and you can create the predictive algorithms, which we've done, to say you should build here. Or within your existing healthcare facilities, this is where you should open your next neurosurgical service. So you need to build the capabilities in places to reshape medical deserts. And the other thing you need to do is create access. And we have used our own use case of using this in northern Ghana to locate tricycle ambulances in the optimal locations to get people to hospital. Roads wash out. We can use geospatial data mapped with this foundational data to create the predictive analytics using weather, road, topography. So it's fascinating to see how you can reshape using this type of data. And these are real use cases that are happening now. And I can only begin to think of the kind of use cases we're going to open up as we expand this work.
Can I just add one thing? So I think one other thing that's been really, really incredible, I think, is data and AI is great, but oftentimes one of the big challenges we have is that the interface for accessing it is difficult, right? And so I kid you not, there's, I think, notes and emails from 2013 when Databricks was founded where we're like, well, we want to help doctors do this. So what do you think are the chances we can convince doctors to learn R or Python? And then we're like, we'll have a training and we'll kind of go through that, and maybe so. And I think we thought about this a lot longer. I think the answer was we should have just been smarter and seen the future. I think one of the great things about, generative AI is that there's oftentimes this mismatch where you have deeply technical folks who are able to leverage it, but actually the domain experts who want to do it is a much broader set. And that interface is intimidating if you don't meet them where they are. So I think one of the very interesting things that, VF Match is, driving is now with this, can you just give a conversational interface to folks, right? And so, the way that I think about it is, can you give them almost like a chat GPT, or Perplexity, since that's what we cited earlier. Can you give them an interface like that, but one that is, basically understands that domain, understands that world, understands that data so they can interact with it. And so you've now done this thing of exposing data, because the importance is, can you get data AI be used? And now you're handing in the people who need it with basically no learning curve from them other than, oh, I should ask the question this way or that way, but supporting different languages, different parts of the world. I think that is also a huge part. We talk about being able to democratize access to data and AI. For me, that's one of the most, promising examples of being able to put that power in people's hands who need it without a huge learning curve.
That is actually, Sharon, a part of our 2025 roadmap with Databricks, actually putting that interface to chat with. So some of this data will be structured and we can do these analytics on it. And some of it's unstructured. There's so much, what we call these mini knowledge graphs. There's so much information around each of these healthcare facilities, either these healthcare NGOs. And that's exactly it. The end user, a clinician like me, just wants to be able to talk to it in a way that it can see it. It's visually appealing. It wants to engage me. And that's what we've really tried to do with vfmatch.org. And the Databricks capabilities have really helped open and unlock that. So you did get to what you were trying to do with the physician.
Just a little bit later.
Just later. Oh, we did get to what we wanted to do as well, just a little bit later. So that is a key component. Yeah.
That's really powerful. And now you're basically going to universities and nonprofits. That helps a lot in terms of creating the language for the end user, right?
Yeah.
As well. So it's extremely powerful each way. So